Hello, everyone, and thank you for joining me. My name is Jamie Smith, and I am on the psychiatric mental health nurse practitioner track here at Gonzaga. I am in my second semester. I currently work as a labor and delivery nurse at Oregon Health and Science University, where I've been for the last 10 years. Prior to becoming a nurse, I also earned a dual degree in economics and finance, but didn't really use it before going to nursing school. Today, I'll be talking about my personal philosophy of healthcare and healthcare delivery, which has been heavily influenced by my experiences both as a nurse and as a consumer of healthcare. I believe that access to healthcare and the ability to make informed, autonomous decisions is a fundamental human right. I struggle with healthcare delivery in the United States largely due to structural inequities that are inherent in a for-profit system, but also inefficiency. I can't think of any other system where the person who is making a purchase or the person who's making the purchase on behalf of somebody else, like providers, neither of them know how much something is actually going to cost the consumer. We have health insurance companies who add really no value to healthcare delivery whatsoever, and we are essentially allowing them to practice medicine by dictating what care patients can and cannot access. We have pharmaceutical companies who are using IP laws to essentially create monopolies on certain drugs that allow them to price discriminate and price gouge consumers, making care unaffordable. We also, have hospitals and clinics who are refusing to safely staff because they really don't have any major consequences for not doing so. Nobody's really holding them accountable. So the system as it stands is unfortunately designed in a way that prevents us from being able to fully honor our ethical obligations to our patients. And it's led to an enormous amount of burnout amongst our workforce. These things have really shaped my personal philosophy of healthcare, and it's why I believe that advocacy is essential to our professional practice and role as advanced practice nurses. We cannot help our patients thrive in a system that is designed for both of us to fail. We have to use our voices to advocate for policy changes that will allow us to deliver healthcare that our patients so desperately need and deserve. I personally believe in advocating for systems that promote equity, justice, and harm reduction. Additionally, I place really great value in collaboration, coordination of care, and patient education. I strongly believe that patients deserve that their provider feels like their teammate, somebody who is listening to them, someone who will validate them and will work with them to create a plan of care that makes sense in their lives, which leads me to the importance of coordination of care. In mental health, some of our patients are probably going to be waiting months for their appointment, and it's really not helpful for them if we come up with a plan of care that doesn't take into account what type of insurance they have, what type of prescription coverage that they have, because we essentially might create a plan of care that they actually can't follow through with because they can't afford it, and then we've wasted our time and their time. We need to familiarize ourselves with all the insurance plans that we're in network with. We need to help patients learn how to access their formularies so that they know ahead of time how much a medication is going to cost them and if it's sustainable for them. We need to be familiar with community resources in the area that are actually accessible for patients in that moment instead of making them referrals to places that they might not be able to be seen for months and months and months. We need to make sure that we're setting ourselves and our patients up to succeed, which segues into the importance of tailored patient education. I believe in educating our patients about their diagnosis and condition in a shame-free environment that validates their lived experiences and their traumas. I believe that health promotion is an essential part of our work as advanced practice providers, but we also need to understand that there are massive inequities at play that prevent patients from being able to fully implement health promotion measures in their lives. And this is why I believe it's so important to educate our patients in a way that focuses on harm reduction. If a patient lives in a food desert, if they can't afford whole fresh foods, if they're working 3 jobs, if they're depressed, then educating them on the importance of diet and exercise isn't probably going to be helpful to them in that moment. So our education efforts should really be focused on what achievable steps can we help them make to get them closer to reaching their goal of wellness. So, in summation, my personal philosophy of healthcare is one that is rooted in advocacy, social justice, and harm reduction, and that utilizes patient centered collaboration, coordination of care, and education. Thank you all for giving me your time and ears, and I look forward to watching and learning all of your videos and philosophies and conceptualizations on healthcare delivery.